Hello and welcome to this free webinar to learn about Buteyko breathing. My name is Korina Flint, and I'm a Buteyko breathing instructor and registered respiratory therapist. I also hold the certification in clinical sleep health. Thank you so much for watching this free webinar about the Buteyko Breathing Method. The method has helped me and many others to breathe our way to better health. Our objectives for today are, first, of course, you're here to learn more about the Buteyko method. And you'd probably like to know, how can it help your health or your symptoms that you're having? Then I'm going to show you how to do an easy measurement of your breathing. Lastly, I'll explain about the advanced Buteyko method and course. So your first question might be, why should I think about how I breathe? Many of us think of breathing as something we don't have any control over, as something our body takes care of for us. Or something I hear a lot when someone wants to be funny is, I already know how to breathe. And while that is the case to some extent, we're all well aware of the effect our dietary and other lifestyle choices have on our health. Everyone knows that if we subsist on junk food and watch TV all day, our health will suffer. We're also aware that if we eat too much or too little, it will affect our health. Whereas improving our diet or exercise benefits our health. But what about breathing? The average person breathes about 22,000 times per day. Breathing is quite literally part of the foundation of life. Medical science is well aware of what happens when we don't breathe enough. We have ventilators and sleep machines with masks. But what about breathing too much? Is it possible that how we breathe can directly affect our health? That is the question that Dr. Konstantin Buteyko asked in 1950s Russia. I'll briefly tell you the origins of the Buteyko method, but I won't dwell on it too long since I know not everyone is crazy about history. In the 1950s, when training to be a doctor, Dr. Buteyko noticed that the more critically ill a patient was, the more they breathed. He saw patients near death taking big, gasping breaths while getting less and less oxygen. It just didn't seem to make sense why breathing more led to less oxygen. He hypothesized that lowered carbon dioxide levels or hyperventilation from breathing too much were to blame for their worsening condition. More on the science behind that later in the presentation. He was then also struggling with his own serious problem with dangerously high blood pressure. Experimenting on himself, he soon trained himself to breathe less and had shortly healed his high blood pressure completely. After completing his medical studies, he went on to conduct clinical trials that confirmed this theory. He developed his method and went on to help many patients with asthma and other serious illnesses to improve or reverse their sickness, including his wife who suffered from asthma. So what exactly is the method? To summarize, firstly, it is a completely non-invasive method of retraining a person's breathing by doing daily exercises. During practice, there is focus on reducing both the volume breathed in and out, as well as how fast a person breathes. Nasal breathing is emphasized. In fact, scientific evidence is mounting of the importance of always breathing through our nose. Not only does nasal breathing instantly decrease the volume of our breaths, but our nose humidifies the air, and nitric oxide is produced when we breathe through our nose. Nitric oxide itself has a host of beneficial effects in our body. By doing these exercises, a person's breathing becomes calm and relaxed, and improvement in health follows. Some of the science behind this will be discussed in future slides. But now you know about this method, you might be thinking, wait a second, I thought taking big breaths more often gives me more oxygen. I don't understand why it would be good to breathe less. If you're thinking this, you're not alone. In modern culture, we are often encouraged to take big breaths in order to calm down and get more oxygen. We might even be told that by our doctor. We often see quotes like this one, that big breaths will make us feel better. It is common to see both adults and children breathing through their mouth, even at rest, and especially during exercise. Cultural norms definitely influence us, but does that mean that they are always healthy or right? It's culturally normal to get a supersized meal at a fast food restaurant. Does that make it good for us? And medical science continues to evolve as it is learned that something we thought was healthy, or at least not harmful, is really hurting us. For instance, not that long ago, it was common for health professionals, doctors, and nurses to smoke while working in the hospital. Smoking in hospitals was only banned in America in 1992. So here's a brief overview of some of the science behind why the Buteyko breathing method, why breathing less actually gives your body more oxygen, contrary to public belief. The foundation of the breathing Buteyko theory is the physiological phenomenon called the Bohr effect. Discovered in 1904 by scientist Christian Bohr, the Bohr effect is well known and taught to doctors and other medical professionals like respiratory therapists. The summary of the Bohr effect is that an increase in arterial carbon dioxide, or the carbon dioxide in your arteries, decreases blood pH, which weakens the chemical bond between hemoglobin and oxygen. That means when there is more carbon dioxide in the blood near tissues and organs, it's easier for the hemoglobin to let go of the oxygen molecules and get them where they need to go. To simplify this, most people know that the hemoglobin in our red blood cells carry oxygen molecules that we breathe into our tissues and organs. As red blood cells pass through the smallest vessels of our lungs, they pick up lots of oxygen molecules. This is like an empty train picking up its cargo at the station. At this stage, the hemoglobin is fully saturated with oxygen, or in other words, all the train cars are full of oxygen. Most people have fully saturated hemoglobin. A normal pulse oximetry level, that's that little clip they put on your finger at the doctor's office to measure your oxygen, is 95 to 100%, which at that point, 100% means that your hemoglobin can't fit any more oxygen. However, now imagine our cargo train goes from station to station, and there aren't enough workers to unload it. It's not hard for us to imagine right now with the shortage of workers that we have. Much of the cargo would just stay on the train. So just as a cargo train doesn't do much good if it doesn't get fully unloaded at each stop, if the hemoglobin's chemical bond to oxygen is too tight when it gets to the tissues and organs, it doesn't unload all of the oxygen from the train, and the oxygen will travel right back to the heart and lungs without being fully unloaded. By breathing too much, we breathe out too much carbon dioxide. This causes our hemoglobin to hold on to oxygen molecules too tightly. So when our doctor checks our oxygen level, it's normal, even though the body may be starving for more oxygen at the organ and tissue level. Another way to visualize it is we've probably all known a dog who wasn't very good at playing fetch, just like my mom's dog Trinket. She was great at going to get the ball, but wouldn't drop it again so we could throw it, and our game of fetch wasn't very effective. Similarly, if hemoglobin doesn't let go of the oxygen, it can't get filled back up with more oxygen again back at the lungs because it's already full, and our game of fetch just isn't much fun. So to review, hemoglobin holds on to oxygen when there isn't enough carbon dioxide. However, when there are healthy levels of carbon dioxide, it's happy to let the oxygen go and do its job in our body. Thus, our brains, hearts, other organs, muscles, and cells all get the oxygen they need. So if we're in this bad cycle, how do we fix it? Well, we need to increase carbon dioxide in the lungs, in the blood and the lungs. There are at least two ways to do that. when we exercise, our muscles create more carbon dioxide. However, if you breathe too much during exercise, like the person shown on the left, you may negate the beneficial increase in carbon dioxide levels. The other way is to learn to breathe less. Buteyko theory is that if you decrease your natural breathing volume at rest, this will increase your carbon dioxide blood levels, decrease your blood pH, and increase your oxygen delivery where you need it. By learning Buteyko breathing methods over time, the body and brain are trained to breathe effortlessly during rest and calmly during exercise. Breathing less improves symptoms of chronic disease over time. This MRI scan vividly shows the result of overbreathing on getting oxygen to the brain. The MRI on the left shows someone breathing normally with high levels of oxygen represented by red and yellow, versus the brain scan on the right with someone overbreathing or hyperventilating for only 1 minute, with the resulting drop in oxygen to the brain, showing up with dark blue. Impaired oxygen delivery affects everything, to memory, to headaches, to anxiety. In addition to the increased levels of free oxygen, having the proper levels of carbon dioxide in the body has other positive effects. Carbon dioxide is not just a waste gas that we breathe out, as many of us were led to believe. The first effect is vasodilation. This is when the blood vessels relax and the internal diameter increases. This means more blood goes to our hearts, brains, and other vital organs. Also, it takes less effort to pump blood through a larger tube, so this leads to less work for the heart, which in turn can lead to a reduced resting heart rate and blood pressure. Carbon dioxide is also a bronchodilator. If that term is familiar, it might be because some asthma inhalers are also called bronchodilators. Dilated or enlarged bronchial tubes are relaxed and easy to breathe through. This is why so many asthmatics have seen dramatic and quick improvements in their asthma symptoms when doing Buteyko. Dr. Buteyko proved this bronchodilation effect in his Soviet lab. And in 2018, there was an animal study in Canada that showed the same effect. Carbon dioxide is a powerful natural sedative. In other words, it helps to relax the brain and nerves so that they are not so excitable. Oxygen itself is a calming agent, so the combination of normalized levels of carbon dioxide and oxygen can decrease anxiety, stress, and even seizures. There was a study that showed that inhaled carbon dioxide stopped seizures in rats. In addition to the fact that nasal breathing and breathing less decreases the number of harmful microbes we breathe in, Buteyko breathing promotes calm, measured breathing, which can help the body not to be stuck in the fight or flight mode or sympathetic dominance. This is one reason that Buteyko breathing strengthens the immune system, as being constantly in this fight or flight mode is known to weaken a person's immune system. Since carbon dioxide increases oxygen delivery to the muscles, decreases sympathetic dominance or fight or flight, as well as calms down their nerves, it can cause tense and painful muscles to relax. And there's much more that we don't have time to get to today. So you might be wondering, well, how do I know if I breathe too much? Dr. Buteyko developed a simple test to see the state of a person's breathing, called the control pause. Or in the advanced Buteyko method, we call it an easy breath hold. Are you ready to try it? I'll explain how to measure your control pause, and then we'll do it together. You'll need to get out a timer on a watch or a phone. You'll take a normal breath in, breathe out normally, and then start the timer while gently squeezing your nose. Breathing out normally does not mean that you try to exhale all your breath. There should be a normal volume in the lungs. During the breath hold, some people like to close their eyes, others like to focus on a point in the distance. Whatever you decide, it's important to be really relaxed, focused, and it's best not to look at the timer or have any kind of goal in mind. We want to stay objective, like scientists. At the first sign of air hunger, stop the breath hold and the timer and take a normal breath in. If you feel the need to take a big breath in after holding your breath, you held your breath too long. And what is air hunger? It is a mental or physical desire to breathe, and each person experiences it differently. For most people, it is a feeling of heat, constriction, pressure, or the mental desire to breathe. And it's located in the upper chest, neck, or head. Just to review, you'll need a timer. Relax, take a normal breath in through your nose, breathe out normally through your nose. And as soon as you've breathed out, gently pinch your nose and start the timer. Stop the timer when you feel the first sign of air hunger or the need to breathe, and take a normal breath in. Okay, now whenever you're ready, I'm going to give you about 60 seconds to do your breath hold. Okay, how did you do? Most modern people will have a breath hold between 10 and 20 seconds. This is an indicator of chronic disease. According to Buteyko theory, if your breath hold was in that range or lower, you most likely have one or more symptoms of chronic disease: fatigue, trouble breathing, cough, anxiety, high blood pressure, weight gain or loss, allergies, skin disorders, and more. When a person's breath hold is between 30 and 50 seconds, many of these symptoms disappear, or they don't trouble the person, but optimal health is achieved at a breath hold of 60 seconds or above. If your breath hold is lower than you would like, Buteyko can be used to gradually and gently help your brain and body to learn to breathe less. As you restore optimal carbon dioxide levels, you will notice certain symptoms becoming less severe and eventually resolving. Everyone's health and body is different, so people react at different speeds, but everyone notices progress as they lower their natural breathing volume and increase their breath hold time. For instance, those with asthma should notice less shortness of breath, wheeze, or cough, and those with sleep apnea should notice less snoring or even need lower and lower levels of CPAP. These diseases pictured are just some of the diseases that Buteyko can improve or revert. There are over 200 that Dr. Buteyko documented. This might seem too good to be true at first, but similar to how our diet affects our entire body, how we breathe literally affects us from the top of our head to the tips of our toes. So it is not surprising that Buteyko breathing can help many different body systems. It's not a cure-all, but all of my students that do the practice have seen benefits from it. I personally have experienced benefits in my asthma, migraines, sleep, fatigue, fibromyalgia pain, appetite, weight, and exercise endurance. I'd also like to call out long-haul COVID-19. also called long COVID or post-COVID syndrome, since many are suffering from long-term symptoms from COVID. Interestingly, a study that came out in the end of 2021 showed that people with long COVID have low levels of carbon dioxide. Some of my students have reported improvement in these long COVID symptoms with doing Buteyko breathing, as well as getting through an active COVID infection more easily. You might be wondering why more people don't know about this if it's so great. Actually, Buteyko breathing is mentioned quite frequently in the New York Times bestseller Breath by author James Nestor. And so it is coming more and more into the public eye. People are turning to it as they are frustrated by dead ends in their healthcare. In sleep medicine, there is a growing number of doctors and clinicians that are becoming more aware of the importance of nasal breathing. It is to be hoped that in time, the importance of breathing less will be embraced by more medical practitioners. However, there are likely many reasons why Buteyko breathing is not accepted yet in mainstream medicine. After Dr. Buteyko made his discovery, he expected the medical community to embrace it, to revolutionize medicine. But he was ridiculed and largely ignored until 1983, when the Soviet Health Ministry finally acknowledged his method. Likely a large reason for this is no one can patent it and make lots of money off of it. Once you learn it and your health gets better, you will likely spend less money on healthcare. No pharmaceutical company or insurance company, the big players in Western medicine, can make a lot of money from it. In fact, they would likely make less money if more people practiced Buteyko. Buteyko theory also contradicts current cultural and medical ideas about breathing, so mainstream medicine largely rejects it. This is not uncommon. When Dr. Semmelweis promoted hand washing and antiseptic technique in the mid-19th century, he was also ridiculed and ignored, despite the fact that hand washing is now understood to be one of the foremost ways to prevent infection. Another reason may be because it is not an easy way out. It takes effort and dedication to learn, so it likely does not appeal to someone who just wants to take a pill and doesn't want to make any lifestyle modifications. You might wonder, why do I need to take a course? Why can't I just watch a few YouTube videos like this one or read a book? You certainly can try to do this on your own, but most people do fail without an instructor. This is because every person is different, and a course needs to be customized to each student. Additionally, Buteyko is powerful and can have adverse effects if not done correctly or done too aggressively in some conditions. I can tell you from my own personal experience that I tried to learn Buteyko from books and videos, and I'm pretty good at learning things on my own, but I was not able to learn how to do this properly, and it caused me to feel too much shortness of breath when doing the exercises, so I gave up for some years. Once I started with an instructor, I was helped to learn how to do it without causing shortness of breath or panic. I really wish I had signed up with an instructor sooner. Another thing about taking the course and having personal coaching is help with motivation. One of my students had taken a Buteyko workshop years ago, but she didn't keep up with it. Now that she's taking the course and having personal instruction, she states that it's much easier to find the motivation to do the exercises, and we've been able to tweak her technique to make it more enjoyable. One other factor is people with serious health conditions like heart conditions or high blood pressure. The method is very powerful, and it actually can be harmful to do this without an instructor that customizes the course to you personally. I do offer a free half-hour virtual consultation. Are you still not sure if Buteyko is for you? Or do you have specific questions about your health issue? Or if you would like to meet with me to see if we would work well together, please schedule your free consultation today. You can either use this website or scan the QR code. Each week, I post content on different diseases and symptoms that Buteyko breathing can improve, as well as general wellness tips related to practicing Buteyko breathing. You can also check out my YouTube videos. For instance, I have a video that runs through the breath hold test we did earlier. Here are some references. Please feel free to contact me and I can send them to you if you're interested. If you'd like to learn more, please feel free to text or email me. I'd love to hear from you. Thanks again for watching, and don't forget to subscribe to my YouTube channel.